So, greetings, friends and followers. This is Nurses Talking live with Dale. And again, it is October, and again, we are talking breast health. Check my pink. If you're joining us for the first time, well, welcome, welcome, welcome. And if you're a returning listener, thank you so very much for joining us. Let us know where you're looking at us from. Put a little, thing in the chat. So today my guest is Khaleela Umheni. Khaleela is a nurse. She is a certified OR nurse. She's also a legal nurse consultant, and she comes to us today because she's talking about preventive breast surgery, which she chose to do. So, Khaleela, thank you so very, very much for joining us.
Thank you for having me.
Yeah, my pleasure. Before I go on, I meant to say to everyone also, if you have questions or comments, put them in the chat. We'll get to them towards the end of the conversation. So, firstly, Khaleela, briefly tell me about your nursing background.
So, I've been a nurse for almost 20 years. Some of my background is med-surg nursing. I started off in med-surg nursing. Then I went into the operating room that's where most of my experiences is an operating room. From there, I was the educator and then focusing more on patient safety and patient outcomes. And still work in the hospital, but now I do legal nurse consulting.
Good, good. And I ask you about that because I want people to realize that your own nursing background is wide, and I'm sure played a role into your decision. So, as I said to everyone at the beginning, you elected to have a preventive double mastectomy.
Correct.
You want to tell us why?
So, just kind of going back. So, when I was younger, I found out that I had it's a gene called BRCA1. I have a very, very strong history of breast and ovarian cancer in my family. Out of seven sisters, my mom including, um, five of them have actually had either ovarian or breast cancer. And my mom personally had breast cancer in her 30s and actually passed away in her 30s from breast cancer. So that led me to, based on that, I decided to get genetic testing, which was very rare back then. This was maybe almost 20 years ago, whenever I did consider genetic testing. At that time, insurance didn't even cover it.
Yeah.
Um, and so I got the genetic testing done, and it came back BRCA1 positive. And based on those results, it basically determined that I had an 80% chance of getting breast cancer. And
Mhm.
then if I was to develop breast cancer, I was had a 50% chance of recurrence.
So that's quite high. And
Yes.
you found this out like 20, you're in your teens.
I would say I was maybe 17, 18 years old, so pretty young.
So how does that impact a teenager?
Well, it definitely makes you think about life a little bit differently. Um, knowing that, of course, the doctor had explained to me, like, at some point you may want to consider preventive surgery, with your family history, and being BRCA1 positive is something to consider. So for me, just my personality, I don't want one thing to define my entire life.
Exactly.
so I knew there were some things that were important to me. Personally, I wanted to go ahead and be able to have kids and breastfeed my kids before. I did kind of give myself like a personal cutoff age
Mm.
on whether or not, like, if I had kids or not, if I breastfed or not. I was going to have to, um, at some point, make that decision. So initially, I elected to do like the surveillance
Mhm.
growing up, which is the MRI with the breast ultrasounds and the CA125 every 6 months, and alternating the ultrasound and the MRI every 6 months, to, if there was ever something to be caught that I would, early. But
Mhm.
from knowing that, like at that age, I already knew that I was going to eventually have the surgery because my thought was, you know, 80% is pretty high.
It's pretty high.
80% is pretty high. And then my thought was like, I know many people have, survived breast cancer or even suffered from breast cancer. And it was just kind of like me trying to take control, a little bit of control over the situation and saying that at least whenever I decide to do it, it's on my time versus whenever you do get diagnosed with breast cancer, it's like it just hits you and like you have to make all the decisions at one time
Yeah,
unexpectedly.
yeah. And so you made all of these decisions at 17?
Well, I definitely knew then because I watched a lot of people pass away in my family, a lot. And as people say, cancer sucks, and it really does suck. It takes a major toll on your family, your body, and then everybody around you. I mean, I lost my mom when I was 7 years old. So, and then seeing, several of my aunts pass away. So for me, it was very real. Like it wasn't like a distant thought of, oh, it's breast cancer. That's never going to happen to me. I'm living it. I'm seeing it every couple of years in my
Mhm.
family that this is
Yeah,
happening.
yeah. So I want to ask, well, I know that this is a family thing,
Mhm.
but what kind of support did you have in this decision-making process?
Well, I have one aunt that has survived breast cancer twice, and her support definitely helped. As I got older, I did join some support groups. There's a lot of different
Mm,
support groups out there for people that do have BRCA1, BRCA1 or BRCA2. There's support groups out there that help navigate people through their decisions. And as I always say, it's a personal decision on your results. You can choose to do surveillance or you can choose to move forward with the surgery because like anything, it is a loss or it
mhm.
is going to be a change in your life. So you have to really take all
Yeah,
those things into consideration.
yeah. But you took, how much time did you take before you decided I'm going to do this now, and why now?
Well, it took me a while before I met my husband,
Okay.
to, to be honest with you. And then, we wanted to have kids because breastfeeding was something personally, important to me. And
Mhm,
actually,
mhm,
um, exercising, eating right, and actually breastfeeding actually helps reduce your chances of breast cancer. And
mhm.
so I really wanted to have that experience. So we really probably wanted more kids, but we're kind of older, older. So after number two, I think my son was I had breast like it was coming up on almost a year, and so I was like, okay, we're done breastfeeding. I need to have my surgery, and definitely the pandemic did play a part in that too
Okay.
because they weren't doing any
No electives. Mhm.
elective surgeries during that time. So
Yeah.
of course I couldn't have it done during that time period. And then I had to wait 6 months after I got done breastfeeding before I can even go forth with the surgery.
What was required, and I want to ask these questions for people who may be looking at me, but what was required as part of your medical preparation for this? What was required of you?
Well, definitely you want to be in, the best health as possible going into any surgery. These surgeries can take anywhere from 4 hours to 12 hours. So definitely want to make sure that no smoking, absolutely no smoking, balanced diet. If you need to lose weight, lose the weight before going in. Um, I elected to do implants. You can do implants or you can do where they reconstruct with your own tissue in your body. Um, Once again, it's personal decision for me. I elected to do implants because I had two small children. Um,
Mm-hmm.
and the recovery between the difference in recovery between both of them, I just felt like for implants, I wanted to have the surgery really soon because I was getting closer to my 40s, and I was like, knowing my mom passed away in her 30s, I really wanted to go ahead and have the surgery, and I just didn't think at the time that my family can handle me being down for such a long period of time.
Mm-hmm.
So, going in, of course, I saw a general surgeon for the mastectomy part, and then I did see a plastic surgeon before going in.
Yeah. Was there any kind of psychological requirement?
Um, yes and no. I mean, they're going to talk to you before
Hmm.
as you go in to make sure that you're okay with your decision. My oncologist, I had seen oncologists all my entire life, even though I never had cancer. Um, she really did a good job at sitting down and talking to me about the different phases of life because she actually went through the different phases of life with me and
Hmm.
making sure that, like, hey, how are you doing? Um, are you ready to make a decision? She, like, I think she gave me referrals for different physicians like twice before 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 moving forward. And so I do think that if you are struggling psychologically with it, you need to let your provider know. As I said, there is resources out there and support to help with those feelings.
Yeah. You are, so I said you not you're a nurse, you're an OR nurse.
Hmm.
How did that knowledge, not just of intellectually what's going to happen, but um, uh, you have hands-on knowledge of how this works,
Hmm.
right? How did that help you or not in your?
Um, well, I think as being a nurse, it helped me have a little bit more compassion, seeing people coming in and knowing that eventually that I was going to go through something similar um, in those situations. Being a nurse going into having this kind of operation, I had an idea of what to expect. I had already seen implants. I've dealt with implants on,
Right.
in the operating room. I've seen not to get technical, like deep flap trams, which is
Hmm.
different kind of flaps you could have with reconstruction. So I got to see all of them. Like I got, so I really did get a chance to see firsthand, what, implants may look like, what a tram may look like, what a deep flap may look like.
Yeah, and that puts you. From my perspective, I don't even want to use the word advantages, but it puts you at an advantage in the sense that A, you knew early on what you had to face, and B, you were in a position to actually see how this works.
Yes.
Um, so, what would you say to someone? Is that the question I want to ask now? Yeah, probably I'll ask that one now.
Okay.
What would you say to someone? How would you tell someone about this? How this is going to work for them?
Well, first, I would say if you have a very strong history of breast cancer in your family, to talk to your doctor about if you're a candidate to get genetic testing. I think knowing whether or not you have, BRCA1 or BRCA2, that does help you make it informed decisions. Everybody's risk is slightly different depending on what the results come back. And then as you go forth in making that decision, you have to consider your lifestyle, um, what your values are. Some people like their outward appearance, and this can be something that can take a really deep toll on
Yeah.
their mental health. So making sure that psychologically that you're okay going into having a surgery like this, and then as I said, personally, really outweighing the chances of getting breast cancer. um, if you choose not to elect for the surgery, of course I'm an advocate for the surgery because I did it. But I'm not gonna, I always say it's personal decisions, but making sure that you're checking your breast on a regular. They say every month, but you could check it more often.
There you are,
um,
see right there.
actually, just to give a little story, my aunt, the one that had breast cancer
Mhm.
twice, she
Yeah.
found it each time. It wasn't the before she went in, she felt it, and she
Yeah.
went in and she knew,
And
like,
she
hey,
knew. And
she
she
knew,
knew.
like, hey, this is most likely something here. And even after having her preventative surgery, because as I said with the gene, there's like almost like a 50% chance of
Hmm.
reoccurrence,
Hmm.
based on my results of getting a reoccurrence of cancer. So
Yeah.
personal decision, but definitely consider what that can mean for your life. And for me, I personally feel that, I'm more than my breast. I think it's definitely a part of me.
Yeah.
Um, but for me, it was more important that I get to live out my days, hopefully cancer free, with my family on my terms. Because I
Hmm.
know whenever you're faced with a cancer diagnosis, it's like your life just gets completely
Yeah.
upended and things are no longer on your time frame.
Yeah.
And you're not really as in control of the situation as you would like to be.
Yeah. Yeah. Absolutely. Absolutely. And from that perspective, that is, that's almost a directive. It's like, yeah, no. But you mentioned something earlier that I think I would like to come back to because I'm sure someone has this question. You talked about implants versus your own body tissue.
Mhm.
How does that work?
Well, it's, your plastic surgeon will sit down with you and give you your options, and see if you're a candidate for either one. Sometimes you may not be a candidate for one or the other. So that would be a discussion with your plastic surgeon. As I said, for the reason I elected was because of the recovery. There is going to be a little bit longer recovery with that. Some people like the idea of not having anything foreign in their body, so they may elect to do either like a deep or a tram flap instead. Um, because of course, with any surgery, there's risk, you know,
Mm-hmm.
that you would discuss with your plastic surgeon on what your risk for complications with each one of those things and considering your comorbidities or health.
Yeah, yeah. Okay. So I'm going to jump ahead a little bit because I want to know. I know even though you knew early on that you were going to do this,
Mhm.
once you had made the decision and you started the process, um, did you feel like there was anything extra physical or any extra preparation that you had to do as the days approached?
Well, for me, as the days approached, definitely I praying and making sure that I was okay with my decision that I was making, making sure that my household was together. Um,
Mm-hmm.
I had a very supportive family, a very supportive boss and colleagues to help during that time. Actually, after um, going into surgery, I think I had several friends that, because I think at the time, maybe like two and three, or maybe one and a half and three, or something like that, very young kids.
Yeah.
I had people that were made meals, which was just overall nice. And then, of course, I went to, I think really the support groups helped
Mm-hmm.
a lot.
Mm-hmm.
Um,
Yeah.
you would uh, you would see on the support groups where people are like, "Oh, I'm going in for my surgery today," or like they said they call it like, "We made it to the deep side," meaning therefore they had their
Yeah.
surgery
Yeah. The surgery.
that day. So it was definitely motivating to see that. And then of course you have like the cases where somebody comes back and says, oh, unfortunately, I had the gene, and I just found out that I have cancer, and I hadn't got
Mm-hmm.
my genetic,
Mm-hmm.
I hadn't got my preventive surgery done.
Yeah, 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 yeah. That's awesome. That's awesome. And so right here, I think I'm going to say to anyone in your position, take advantage of the support groups. Take advantage of the support groups.
Yes, 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 yes.
So I would like to know now, post surgery, you're prepared for this. You've had years in your, to prepare and to know what you're going to do. Post surgery, what were your feelings like? Did you feel, for example, relief, empowered, loss? What?
I think a little bit of everything. you know,
Mm,
um, I think relief, like finally I've done this. A little bit of loss because I was like, okay, my body is completely different. How am I going to feel? How am I going to look? After this loss in my
mhm.
life, and then empowered because like after a few months, I felt great. Like I was like, I've decreases my chances of getting breast cancer. I am able to now get back to being the mom and the wife and the sister and the and the all the people, we wear a lot of hats. All the people that we want. And then I personally felt like this was like a chance. Like I felt like that feeling of that hanging over my head was finally gone.
Yeah.
Like because imagine for almost how many years I was thinking, okay, every time I go in to have an MRI, every time I go in to have a mammogram and an ultrasound, like, is there going to be something this time? And even one time I did have to get a biopsy because, we thought we had saw something, and I was in my 20s, and so, dealing with that. So for me, it was definitely the relief. And then the physical part of it, the recovery actually for me went very well. Thankfully, it went very well. And then just seeing the changes in my body, and then actually I was pretty happy with my results afterwards. So if we're gonna be I was pretty happy with the results. So once I actually, once the swelling and everything went down and I saw the results, I was like, oh, this is not bad at all. but that's, I mean, everybody's going to feel different,
Of course.
Of course, I had very much support. I've seen all kinds of different kind of mastectomies done. So I was quite happy.
You were quite happy. So I want to know, did this experience teach you anything about you? And if so, what was it?
Well, definitely going through the experience, just of breast cancer in general in my family, it taught me to just value life, value your life, value your health. Also, during the time of my recovery, it gave me a lot of time to think about what was important to me. And then also, passing on information. That's why, like, I said, yes, of course I'll get on here and talk about this. It's also letting people know, because some people like, oh, it's taboo to talk about, these things, and letting people know, like, hey, I did it. If you need support, there's support out there. And, just to be informed about the decisions and the available resources that are out there. Yeah. So I definitely think that changed my outlook. And then, I'm pretty sure you saw my post on LinkedIn. It was like a year later, like I was like in the gym and I was like, I'm lifting weights again. I'm feeling great. Like this was not what I expected to feel.
You sound as though you feel liberated.
Yes, I feel liberated. I feel great. And I'm like, oh, this is, I wouldn't say why because I think, everybody waits as long as they need to. Some people make immediate decisions. I know some ladies in their early 20s made the decision to go ahead and forth as soon as they knew. Because, some people, the psychological thinking of, do I have breast cancer? Do I have breast cancer?
Yeah.
Also takes a toll on some people. Or even like, hey, am I attractive or after surgery? So definitely want to share the information with everybody that's out there. Consult your oncologist. If you have one, consult your PCP. If you have a high risk, and even if you go see a plastic surgeon or a general surgeon, you don't have to make a decision then. You know what I mean? It's just getting the knowledge that you need to feel comfortable with whatever decision you choose to make.
Yeah. Do you think that, from a nursing point of view now, has that decision, that experience, changed in any way the way you approach patients, particularly those who maybe face life-altering decisions?
Well, yes. Helping them to support them through those difficult times. Because this, even though in healthcare we experience something every day, your patient is experiencing this most likely for the first time in their lives, and they are trusting us to provide them comfort, to answer their questions, and to show that we care. So for me, that has definitely shaped how I approach healthcare in general, from being at the bedside to patient safety to legal nurse
Mhm.
consulting. It really affects my approach on all
It's
those things.
affects you. Mhm, mhm. So now, you were talking about being in the gym. And so I also think I was about to ask you then, many of us, when we speak of things like health and wellness,
Mhm,
um, often it's kind of surface,
mhm.
you know. So how would you say you define those things now after having gone through this?
Let me think about that one. um, well, I will definitely say the first time, like going back into the gym, I was like, "Am I ever going to be as stronger as as I was?" And then as I started doing squats and trying to do pull ups again, trying to do pull ups again, um, I realized that our bodies and our mind are capable of doing all kinds of things. And so that definitely allowed me to trust my body more, um, and what it can do.
Yeah, yeah. So I asked you a little while ago about what kind of, encouragement would you give somebody who's going through this? But also now I want to ask you to look at it from the other side. And what kind of, maybe encouragement is still the word, would you give to a healthcare professional? What kind of information you think you'd like to pass on to healthcare professionals who are taking care of patients who are facing or who have had life altering, um, not even surgery, but life altering experiences?
Well, if you're dealing with somebody that's trying to make a decision on whether or
Mm-hmm.
not to have surgery, just letting them know that there's no right or wrong answer. It's going to be up to them, and supporting that person in whatever decision that they decide to make. Of course, make sure that they're informed of all the recommendations that are there, but not pushing them one way or the other. Just arming them with knowledge, and then helping support them through those
Yeah,
thoughts.
yeah. Okay. Khalil, let's look in the chat. Let me see if I see anything there.
Okay.
Okay, so we don't have any messages in the chat at the moment. But so I'd like to ask you, first of all, thank you, thank you, thank you, thank you, thank you, thank you, thank you for doing
Oh
this.
yeah, a pleasure.
I truly appreciate it because I really feel that that's such a decision to have to make. And oh, by the way, before we even go there, kudos to you. I'm going to tell everyone that I think it was during this time actually that you actually started your business.
Yes, I did.
Look at you go.
um, as I said, it really, it just when you go through something like it just makes you really evaluate what do you want,
Mhm.
what you're passionate about, what's your vision, who do you want to help, and then for me also not focusing so much on yourself.
Mhm.
Helps
Yeah.
because sometimes you can get swallowed into thinking, oh, all about me, oh no. But like actually
Mm.
thinking like, oh, who can I help? You
Yeah.
know, what do I see my like I almost like felt like what do I see in my future? What do I see in my future? So that is definitely um during that time because I'm used to doing a lot of things. I had to sit very still. Because as I said before, like I couldn't raise my arms more than like 90 degrees, and
Mhm.
I couldn't pick up my kids. So I definitely had time to sit down and think. And so it came to me. And since then I've ran with it. I actually really enjoy doing legal nurse consulting.
Awesome, awesome, awesome. So if you could leave us with three things, what would they be?
Um, you know your body, check your breast, get informed, and if you need help, get support.
Yes, yes. Know your body. Know your body.
Mhm,
I can't stress that enough.
mhm, mhm.
I really can't stress that enough. So, Khaleela, thank you, thank you, thank you for doing this. I so appreciate it. And to everyone listening out there, I hope that knowledge be comfort to you and community be strength. And our next step be kind. Thank you so much.
Thank you.